Good morning, everyone. Welcome to Grand Rounds. Next week, our Grand Rounds speaker will be Catherine Wisner from Northwestern. Catherine's, I think, known to everyone as someone who's been active in women's mental health, particularly in depression and perinatal mood disorders. And this is the Alexander Glassman Memorial Lecture. Today, we have a guest visiting us from the University of Minnesota, Dr. Stephanie Carlson. Dr. Carlson received her undergraduate degree at Bucknell, then went west to the University of Oregon, where she received her PhD in psychology and specialized in cognitive development. She remained on faculty at the University of Oregon before moving north to the University of Washington, where she was on faculty till 2008 when she was recruited to the University of Minnesota, where she has been ever since and has risen to the role of a distinguished McKnight University professorship, and is in a department that's headed by Megan Gunner, who's a very prominent person in the same field, and she's director of research of that institute, and she also is the chief scientific officer and CEO of a startup called Reflection Sciences, which you'll tell us something about, maybe? Which shows you, courtesy of, I guess, Bayh-Dole, the ability for academics to be increasingly entrepreneurial. Dr. Carlson has had a very prolific and distinguished research career, which she's focused really on infant and child brain development, and specifically with a focus on cognitive psychology and neuroscience. So it's kind of like a latter-day Piaget. And whereas Piaget, as I learned most of his psychology from just watching his children grow. In the modern era, we have laboratories and universities and all kinds of technology to be able to do that. But it's hard to think of sort of an area that's more important than looking at early child brain development. And I think the interesting thing that I'm hoping Dr. Carlson will be able to share with us is not only some of her research, but some of the ways that her research has led to interventions or applications that are currently being piloted, if not disseminated, in clinical populations. So it's a pleasure to welcome her here today, and please join me in welcoming Dr. Stephanie Carlson.
Thank you for that introduction, and good morning. I'm really delighted to be invited to speak with you today. I'm going to be talking about executive function in childhood. As Dr. Lieberman introduced, a lot of my work is in the kind of developmental, social, cognitive neuroscience realm, so I try to fit the whole kitchen sink in there. Most of my work is behavioral. And through collaborations, I've done some neuroimaging work as well. He also mentioned Reflection Sciences, so I need to give you my disclaimer that this is a startup company out of the University of Minnesota. Perhaps you have similar initiatives and enterprises here at Columbia. I'm going to be talking today about a measure that we developed called the Minnesota Executive Function Scale, and we use it in most of our research. And so I just wanted to let you know about this other interest of mine. So we're going to be talking about a pretty large agenda today, and I decided to kind of do more of a survey and overview, walking you through kind of what is executive function all the way to some current day applications. And it's a lot it's an ambitious agenda, so perhaps we'll hold questions until the end, unless there are some burning clarification questions. Okay, so starting with definition. And I do kind of look forward to the day when I don't have to start every talk with a definition of executive function. I mean, imagine if we started a talk and I had to define literacy for you. And yet, it's as important, at least as important as early literacy. So what is it? These are neurocognitive brain-based skills. We have a very good sense of the brain basis at this point for executive function, involved in the top-down, goal-directed control of thought, emotion, and behavior. So it does encompass these social and emotional skills as well, because emotion regulation is one piece of this top-down control. By definition, it's conscious and effortful. So as opposed to more automatic forms of self-regulation, things that we really don't have to think about, thankfully, like respiration and digestion and so forth, that are also homeostatic self-regulatory processes. These processes are related to, but distinct from, intelligence. With intelligence, we're talking more about knowledge and what you know, particularly crystallized intelligence, whereas executive function has to do with using what you know in the service of goals. So it's goal-directed, conscious, and effortful behavior. You actually, we know executive function more by its absence. It's conspicuous in its absence, and we kind of measure the relative lack of executive function in young children and see how that changes with age. Some have likened it to kind of the brain's air traffic control mechanism. So if you imagine being an air traffic controller, the set of skills that are involved is you have to kind of prioritize different planes departing and landing. You have to hold a lot of information in mind, including your currently active goal. You have to pay attention and resist distraction. And you have to be cognitively flexible to switch gears in the moment as needed should anything change. So a lot of factor analytic work has tended to focus on these three facets of executive function that work together. So one is working memory. So remember, this is goal-directed behavior. You have to remember what your goal is and hold it in mind. I don't know if you've ever gone to another floor of your house or another room of your home, and you don't remember why you're there. So what's happened in that case is you've actually lost track of the goal. It's a failure of working memory, which happens increasingly with age. Inhibitory control, so this would be ignoring distractions, ignoring temptations, controlling impulses. And cognitive flexibility is changing gears or shifting perspectives. So sometimes if you're not successful in pursuing a goal, you have to get unstuck and stop perseverating on something that's not working, and step back, reflect, and think about your choices for responding. What else could I try here? This also pertains for interpersonal relations and what we call theory of mind. So being able to take somebody else's perspective requires that you inhibit or suppress your own egocentric perspective to be able to take their point of view into account. So these three facets of executive function are somewhat dissociable in especially older adults. Factor analytic work depends kind of what you put into the model, what you get out of it. But they do overlap, particularly in the early childhood period. So interest in the development of executive function has just absolutely taken off in the last 15, 20 years or so. This is the number of publications per year on executive function in childhood in particular. And so this has yielded a lot of really important insights about the development and importance of executive function. So I'll turn now to measurement. It's the cornerstone of just about any scientific endeavor, right? Good measurement. So this has been an issue in the field of executive function, and as well as many other fields of development. So there are questionnaires and checklists. These are some of the ones that are commercially available. This one is actually free for a variety of ages. And the advantage is that they can quickly be filled out by a clinician, caregiver, a parent, a teacher. And they're low cost, both in terms of time and money, for the most part. However, there are limitations associated with these, so they're subjective in that it's a caregiver's or clinician's sort of subjective feelings, beliefs, and observations about the child. And what you always have to sort of ask is, who's your reference point? So parent and teacher report on these measures tend to be uncorrelated. And so I think part of the reason for that is that the reference point is different. Teacher reports tend to have higher correlations with direct behavioral assessments than do parent reports. And part of that is just that parents' reference point might be the child's older sibling. It's sort of the only other kid they've really known well at that stage of development, and that's their reference point. So just some limitations associated with that. On the other hand, with direct behavioral measures, we can see where kids are on the continuum of development of executive function, through their own skills. And executive function processes are skills rather than traits, okay? So this is an example of the so-called marshmallow test. How many of you have heard of this? Okay. Developed by Walter Mischel, who had been at Stanford University, now an emeritus professor here at Columbia. So this is an example of a 4-year-old. Now she has chosen to wait until the examiner comes back so that she can get the larger pile of Fruit Loops in this case. That tends to be a favorite in our lab. But if she doesn't want to wait, that's okay, it's her choice, but then she only gets the smaller pile, okay? And she can ring the bell at any point to bring the experimenter back into the room. Let's just see what she does. Okay, so how is a measure like this tapping into these 3 facets of executive function? So if we think about it in terms of her working memory, she's saying, I can remember the goal of this activity. And in fact, I would argue that working memory was not the problem here. She remembered the goal and in fact tried to cover her tracks, right? Inhibitory control might have been more of the problem here, that the temptation was just too rich for her to resist. And she could have probably succeeded in delaying longer if she had used some cognitive flexibility, like I can think about this in a new way, or distract myself, or adopt a spontaneous strategy like we see some children do of blocking the line of sight, which is a smart strategy, just putting a physical barrier there between you and the temptation, turning around in their chair. Some children will sing a song and make up a song about waiting. She was 4, yeah. So then, in addition, so the delay of gratification is one example of what we call a hot executive function measure because it has a reward component to it. There's something sort of hot and tempting about the distraction in that case, or the goal. But there are other measures here that we call relatively cool measures of executive function, tapping into those 3 facets. And these are just some of the ones that you would be likely to come across in your practice. Commercially available measures that are batteries of executive function assessments. Some of them are lengthy, some of them work for younger children versus older children and so forth. But they have the advantage of being standardized, and many of them have norms, national norms. I do want to highlight then this Minnesota Executive Function Scale is a relatively new measure that we developed starting at age 2. And so this was a real gap and just an obstacle for me to perform my own research. As my research interest in executive function and its development started to shift more toward the antecedents of self-regulation and executive function in younger children, we didn't have tools. They just did not exist any standardized measures for children as young as age 2. And then similarly, as my research collaboratively with my colleagues and students shifted more toward applied work and intervention and prevention programs, we quickly learned that children who are at risk for school failure, for example, children in poverty, will very likely be as much as 2 years behind their more advantaged peers in the development of executive function. And the currently available measures at the time were totally insensitive to that lower range. So there was a floor effect on those tools. So to address that, we developed this scale. It's built around a very commonly used card sorting task. So it's a card sorting task where you have a goal, like we're going to play a game like the color game, and you have to remember it, but the rules change as you progress through the levels and get more complex. And so you have to be able to inhibit then the old way of playing a game, hold in mind the new way, and shift flexibly between them. So we put this in a digital format. This is an iPad and Android platform tool, and children sort cards according to the currently active rule. So here's a green one. We're playing the color game. So this green pig would need to be then dragged into this box because we're playing the color game. But if we were playing the animal game or the shape game, this same card would need to be reconstrued as an animal and not a green thing and put into this box. Sounds really simple for you and me, but it's really hard for young children to do this, to make that switch. This is now, we have data from over 35,000 kids on this tool now, since we introduced it in late 2014. So being used around the US, as well as in several countries, and it's in 9 languages. Our most recent one is, that we're adding is Arabic. So I'm very excited about that. So it's a tablet game. It's administered one-on-one with a certified examiner. There is a kind of a web-based training program to become certified, but it's an A-level assessment, not a C-level assessment. So teachers and non-professionals can administer this validly and reliably. It's very brief, under 5 minutes, and that's because it's adaptive. So we know from our preliminary research in the lab using this tool kind of where to expect kids to land. And so we start at a given level depending upon their age. And it's taking both accuracy and speed or response time into account using an algorithm. So what we're able to trace with the digital format that we weren't very easily with a tabletop format is the transition from being fast from being slow and accurate, so fast and inaccurate to being slow and accurate to then finally being fast and accurate. And this is kind of how it looks. You select a child from an imported list. You select your level, and the recommended starting level will be automatically raised up like this, level 3 in this case. And then this is what it looks like. All the instructions are on the screen for the examiner to guide the child through it. So in this case, this is level 3, and we might play the frog and the butterfly game. Here's a frog, here's a butterfly. Now it's going to be your turn. We do what we call the rule check to make sure that they understand the new rule or the initial rule. And they would have to drag the butterfly to the butterfly box. And then after a few trials, we switch. And we say, now we're going to play a different game. We're not going to play the shape game anymore. We're going to play the color game. In the color game, all the red ones go here, and all the blue ones go here. Okay, let's play. And now they get the same card, which needs to be reconstrued according to this new rule. So 3-year-olds will perseverate on this. And find it difficult to switch, and even 4 and 5-year-olds who are relatively delayed or disadvantaged in terms of executive function also might fail to switch. So what they'll do is, and they can even tell you where do the blue ones go in the color game, and they'll say here, where do the red ones go? And they'll say, here. And then I say, here's a blue one. Where does it go? And they'll put it with the frog. It's really striking. It's very, very, very robust finding developmentally. And they're like frontal patients. And in fact, a lot of the work that we do and the tasks that we developed were downward extensions of Luria's work with adult lesion and frontal patients who could tell you what they're supposed to be doing. They just couldn't execute it. And that's kind of what we're capturing here. Show you a quick example of a 4-year-old. This little girl happened to arrive at the lab wearing a princess outfit. And we actually do study pretend play also. It was just happenstance.
Okay, so for this game, you get to pick which animal you want to be. There's the bear, the owl, the cheetah, and the squirrel. Which one do you like? That one. Good choice. All right, so in this game, first it'll be my turn to touch, and then I'll tell you when it's your turn. All right? Look, I have these boxes here. This one is orange, and this one is green. This is the color game. In the color game, all the orange ones go here, and all the green ones go here. See, here's a green one. It goes in the green box. And here's an orange one. It goes in the orange box. Now it's going to be your turn to play the color game. Can you put this green one where it goes? Good job. Can you put this orange one where it goes? That's right. Okay, let's play. If it's orange, then it goes here. But if it's green, then it goes here. Here's an orange one. Orange ones go here, green ones go here. Here's a green one. Get ready. Here's a green one. Get ready. Here's an orange one. Get ready. Here's an orange one. Now we're going to play a different game. We're not going to play the color game anymore. We're going to play the shape game. In the shape game, all the monkeys go here and all the lions go here. Okay, let's play. Here's a monkey. If it's a monkey, then it goes here. But if it's a lion, then it goes here. Here's a lion. Get ready. Here's a monkey. Get ready. Here's a monkey. Get ready. Here's a lion. Look, I have these boxes. This one has an orange monkey on.
Okay, so then she goes on to then level 5 here, where now she's going to have to play the color game and the shape game in an alternating and unpredictable sequence. So the examiner shows the card and says, play the shape game or play the color game. And then here's where she loses it. She can't hold the hierarchical structure of the task in mind at once. And so she reverts to playing just the color game for the rest, and then sort of fails out. But she has no idea that she's failed out, and she feels really good about it at the end, and everybody's happy. So it's capturing these 3 facets of executive function. So being able to switch between rules, remembering the currently active rule and applying it, and resisting that reflexive response of sorting by the initial rule. So what we really need to be able to see are measures that are sensitive to age-related change in executive function, as well as individual differences at any age, ideally. So first, let's talk about age-related change. The time course of executive function development is closely tied, although not exclusively, to prefrontal cortex development. We see the most striking improvements in the preschool period, although it does continue to improve until one's mid-20s. So insurance adjusters sort of had it right in terms of keeping insurance rates for auto high until you hit 25. And we unfortunately then do see age-related declines in older adults. So in terms of that marshmallow test, delay of gratification, we've given it to hundreds of kids that have come through the lab over the years. And when we put the data together, we do see this general linear trend for increases in wait time before kids will eat the Fruit Loop or the marshmallow. But this is not a super strong relation, and what seems to be more important in this measure and other measures like it is individual differences at any given age. Seems to be kind of where we see the strongest relations with this task. In contrast, the MEFS, the Minnesota Executive Function Scale, is very strongly linearly related to age. So this is data from over 14,000 kids from age 2 to 12. And you can see, a very strong sort of stairwise increase in the early years, but also continuing beyond that. In this case, the 10-year-olds that we had in this sample were all low income, and I think that's why we see the dip there, and I'll be talking more about that in a moment. So this is generally the developmental trend from age 2 to 70 that we've observed. So Phil Zalazo and I put our data together on this card sorting measure between the Minnesota Executive Function Scale and NIH Toolbox in older adults on the dimensional change card sort. And this is roughly the developmental time course that you see cross-sectionally. Now, hopefully we can follow kids until they're 70, and we'll be able to trace this intra-individually as well. So this tool is normed, and that's incredibly helpful, especially for non-academic users who might not have the luxury of random assignment to control groups and things like that, to be able to have a reference point against which to measure changes or growth in executive function in children in their care against some kind of national norm. So the sample is well representative, actually a little bit over-representative for ethnic minorities compared to the US Census. However, it's a bit underrepresentative in terms of economic diversity. So we hope that will change over time, so that we get more of the lower income representation in that norming pool. Okay, so individual differences. As I mentioned, we're seeking sensitivity to age-related change and individual differences. So we do see that individual differences in executive function in childhood predict a host of vital life outcomes, both academic and well-being outcomes. So it predicts school readiness, such as early math and reading ability, and it does so independent of IQ, which is kind of striking because probably the best indicator or predictor of how kids are going to do in school is their IQ. And when you find something that explains variance in achievement over and above that, it's quite impressive. And teachers kind of could have told you that. So they know kids and have kids in their classrooms who are actually quite bright, but can't think their way out of a paper bag kind of thing, or have real problems with emotion regulation. And so these things are, correlated but dissociable. And teachers say, I know how. We have really good tools now and curricula for teaching early literacy and numeracy. And I would rather have a kid come to my classroom who knows how to think, not, what to think yet, but how to think, so that then I have a more receptive learner. And so that's kind of what we're targeting here. It predicts gains in academics, so not just school readiness at a certain point in time upon kindergarten entry, but also growth in academic skills over time. Some long-term prediction studies, in this case using the marshmallow test at age 4, predicting SAT scores, as well as a variety of delay of gratification measures predicting college graduation. Again, better than IQ. And some recent work by the Michelle group has shown prediction from preschool to middle age. So in this case, these were kids who either delayed gratification on the marshmallow test at age 4 or did not, so delayers and non-delayers. And there have been, persistent and consistent individual differences in outcomes for these kids, beyond the SAT scores into their 40s. So the sample is now in their late 40s. And they continue to show differences even at the neural level, albeit the effects are small. And then another study, the New Zealand longitudinal study. This is 1,000 participants who've been followed from early childhood. The most recent publication on this is when the sample is 32 years of age. And they measured executive function using a variety of tools and observations when the kids were 5 to 8 years of age. And they found that executive function in childhood predicted a host of outcomes, including better physical health at age 32, lower drug dependence, higher socioeconomic status, larger retirement savings, for example, and a lower incidence of criminal convictions. And this is shown here, criminal convictions as the percent with an adult criminal conviction as a function of their quintile of self-control measured in childhood. And those in the lowest quintile on self-control, over 40% of them had had a criminal conviction by age 32. So this is, not like getting pulled over. This is a conviction. And then you see this, linear decrease in the likelihood of a criminal conviction as a function of self-control. And then importantly, this is controlling for their socioeconomic status and their IQ when they were a child. So again, we have to parse the variance here because these things tend to be so, so intercorrelated. But when we're looking for independent effects of executive function, it is important to control for these other factors. So we've all heard of the achievement gap. This has to do with things like the vocabulary size of children as a function of their socioeconomic status. And as the child's age increases in months from 10 to 24 to 36 months of age, we actually see a widening of the gap. We argue that something similar might be going on with executive function. And so there's some great work being done here by Kim Noble and others looking at socioeconomic status associated with lower executive function. These data are adapted from Sibel Raver and colleagues. And so this is the executive function measured at age 48 months. So it's a battery including a card sorting measure like the one I showed you. And as a function of the number of bouts of poverty being at or below the US poverty line since the child had been 15 months old. And so as a function of increases of poverty bouts, we see lower performance on executive function. These are Kim's data from a really influential paper in 2007, looking at working memory and as against the SES index and a composite of cognitive control measures. And you see the relation here. And the Minnesota Executive Function Scale also replicates this finding. So in this case, this is the highest level PASC, there are 7 levels of difficulty on the tool. And we have a lab sample, a community preschool sample, and an at-risk sample comprised of homeless and highly mobile children. And what we see here is performance in terms of highest level PASC, controlling for age, and IQ. So these kids were all also given the Stanford Binet verbal and nonverbal intelligence subscales. And the gap that you see here is not attributable, in this case, to IQ. And yes, they were lower in IQ as well, but this is over and above that. And I think it's really, again, an important finding. And we propose that, what we're seeing here, this gap is really the executive function gap that ought to be considered in relation to the achievement gap. So it's also well known that executive function impairments are a common denominator in a number of developmental disorders. So this includes ADHD, most notoriously, but also autism and conduct disorder. So these executive function issues will interfere with learning, achievement, and general adaptation. So it's really important, again, to understand the phenomenon, have valid measures of it, and diagnostic tools to kind of get it right. There is the possibility of false positives that has been raised by some critics, especially in young or more at-risk youth. And that's because of those floor effects on some of the most widely used measures of executive function for younger and at-risk kids. And so, again, if you don't really have a valid benchmark for what is normal in terms of development from a very early age, and if you can capture that sensitively, those very nascent executive function skills, versus just getting a big fat 0 on a measure, then I think we'll be better off and more accurate in terms of diagnosis. So these individual differences in executive function are highly stable, as we've learned through some of that long-term longitudinal research. But I want to emphasize that that's in the absence of intervention. Executive function skills are just that. They're skills, and they can be learned. And it's malleable. So what are the progenitors of development? It's a complicated story, no doubt, one that would take several careers to disentangle. But genetic, brain, cognitive, and social processes are involved. And from a psychological perspective, this is probably where I've spent most of my research, is thinking about what are the psychological mechanisms that are changing and driving executive function development. And here we focused on information processing changes and developments that allow for increases in reflection. So reflection on your thoughts, actions, and feelings. It's almost like if you think about when you get a panoramic view of a scene, you can kind of take it all in versus being narrowly focused on one aspect of the scene. And when you're narrowly focused and kind of close into it, you can't see your options for responding, and it kind of feels like there's only one option here, which is to steal my friend's toy. Feels like there's really only one option here. But if you step back psychologically, or even physically, you see your options for responding more clearly. And that's been the focus then of our intervention efforts and so forth, as I'll mention at the end. There are also neural correlates, and it's obviously hard to disentangle cause and effect at the neural level. We're looking at this from multiple levels of analysis, but we do look at correlates in terms of the development of prefrontal cortex. There is a caudal to rostral development of PFC anatomically, and it is interesting, I think, to think about lower brain areas in relation to this developmental sequence. And so, for example, basal ganglia, even cerebellum, a lot of these developmental disorders that have in common, or this family resemblance of executive function impairments, you might also see things, key signatures like awkward gait. In autism, for example, children will have an awkward gait and some difficulties with balance or coordination. And that could be tied, again, to this caudal to rostral developmental sequence. We also look at environment, particularly caregiving and preschool curricula as progenitors of development. So this idea of reflection, generally what we've seen is that kids go from being reflexive, knee-jerk, impulsive, kinds of just very stimulus-oriented, to reflective with age in general. So infants are stimulus-bound, really not thinking, as far as we can tell, too far into the future or the past. Toddlers are notoriously inflexible and have difficulty controlling their emotions. And part of that is because of this newfound ability to represent things like things that they don't have. And preschoolers are now starting to be able to control their behaviors and hold in mind these goals and rules for longer periods of time and be more controlled, but they are still also impulsive, as we know. And then finally, by school age, children are able to think more abstractly and engage in more of that psychological distance spontaneously for themselves and employ strategies. But of course, we can help them with those strategies. And then I just want to mention that a lot of my research focuses on how language, like bilingualism, and play, particularly pretend play, contribute to this developmental sequence. So what about neural correlates? We did a recent study that was looking at resting EEG, electroencephalogram. So there are these rhythms, EEG rhythms coordinate brain cognitive and behavioral processes. And the EEG power refers to the number of neurons firing in synchrony in a given frequency band. And there are slower bands like theta and beta, theta and alpha, faster bands like beta and gamma. And the ratio of theta to beta power, if this is elevated, it has been linked with ADHD. However, there are mixed findings about this correlation, and there has been a lack of research looking at the range of the theta-beta ratio along with a good sensitive measure of executive function in typically developing children. So that was one thing that we wanted to set out to do here, really two things. One was to do a more comprehensive map of EEG power and how it changes with age, just as a general contribution that we hope to achieve. And then the second one was to look at how EEG power is correlated with performance on executive function. We studied 162 typically developing children, ages 3, 4, 5, and 9. And we actually developed or adapted a paradigm for measuring EEG in children who are so young. And it takes about 5 minutes, and it's a rocket ship paradigm. So we wanted to capture both eyes open and eyes closed. So they're in a dimly lit room with the EEG cap on, and they're observing a slowly moving rocket and planets. And so they're supposed to close their eyes while the rocket is going into space. And then they're told to open their eyes and fixate on a planet for 10 seconds. These are kind of alternating 10-second sequences so that we could capture this and have children be relatively still and relatively engaged. We used a 128-channel hydrocell sensor net. And as is typical in this research, despite the richness of all of these channels, we actually tend to focus on regions of interest in these frontal channels and these posterior channels. And so this is a little bit complicated, so I'm going to walk you through the findings in terms of, again, that first goal of just tracing a map. So what is novel about the study is that is both the age range that it captures in one study and the fact that it's examining both eyes open and eyes closed. Most studies using resting EEG in childhood tend to do one or the other, and we really wanted to look at both. So there are three main findings here that I just want to point out to you. So one is that theta, both in the frontal ROI and the posterior ROI, tends to decrease with age. So this was a well-known finding already. We found that alpha tended to increase with age. The faster rhythms of beta and gamma did not show much change. And the ratio of theta to beta showed general declines or decreases with age. And this is what we were kind of most interested in terms of individual differences and performance on executive function. A second finding is that EEG power tended to be higher in eyes closed conditions for the slower rhythms, but it tended to be higher in eyes open conditions for the faster rhythms. Okay. So the measure of executive function that we used was the MEFS, the Minnesota Executive Function Scale. And just to show you again, very strong age-related change in performance, I'm showing you here two dependent variables. And this is because the study awkwardly spanned the transition from the tabletop measure to the digital measure. And so all of the kids had, well, some of the kids, all of the kids, had some of every age had the highest level passed, which is the dependent variable from the tabletop version. And then a subset of the kids, a smaller subset of the kids, had the digital version with the total score. And so if you recall, then this one's going to be based just on accuracy. And this one, from the digital version, is going to be based on accuracy and response time. So it is a more sensitive tool and more sensitive measure. And so we just display the results for both of those DVs. So I'm going to walk you through just the frontal and posterior eyes open and eyes closed and eyes open conditions. And what we're looking at here, of course, we were interested in and describe in our paper the interrelations among the frequency bands. And these are controlling, all these correlation tables I'm going to show you are controlling for age and IQ, specifically the Stanford-Binet verbal ability subtest. And so what we see here are the MEF's highest level passed and the MEF's total score in relation to the theta-beta ratio. And so recall I said that this ratio is elevated in children with ADHD. So what we would expect and what we found are inverse correlations. So the lower that ratio, the higher their executive function performance. And we see it using both DVs. It's higher for the DV that's more sensitive, the one that uses the digital tool. And then with frontal eyes open, we see the same pattern. Again, controlling for age and verbal ability. It's null for this one condition of posterior ROI and eyes closed. But reemerges, albeit weaker, in the posterior eyes open condition. So to summarize the study, it is a relatively new methodology, this rocket ship paradigm for capturing EEG kids in early childhood, producing for us this map of eyes open, eyes closed, and two different ROIs. We saw that theta power decreased with age, alpha increased, and the ratio of theta to beta decreased. Power was generally higher with eyes closed for the slow rhythms, but higher with eyes open for the fast rhythms. And children with relatively low theta and high beta rhythms, so that's that ratio, relatively low theta and high beta, along with high beta, had greater executive function skills independent of age and verbal ability. So our next steps here are to ask and study, does training executive function? And we have some training paradigms for that. If we train kids on executive function, is it reflected in their EEG power? And another potential application of this is neurofeedback. So if we give kids neurofeedback while connected to an EEG monitoring system, does it lead to improvements in executive function? So I've talked about the psychological, some neural correlates. Now I'm going to end with talking about the role of experience and environment in the development of executive function. So the individual differences that we saw are stable in part because environments tend to be stable. But early experience shapes brain development and may be particularly important, so the role of neuroplasticity in early development. Yet later experience can also modify executive function skills. It's sort of never too late. So where do these individual differences originate? What are their antecedents? If we can better understand where the individual differences begin, we can better address this, this potential impairment in executive function or delay during the period in which is most likely to have a positive impact in early childhood. So one area that we and others have focused on as a candidate for having an environmental effect on executive function is trauma. How many of you have heard of the ACEs? Okay, yeah, a good number of you. So this is the Adverse Childhood Experiences Scale. And it's typically filled out by an adult about his or her own past and childhood. And they simply mark off the number of adverse experiences that they had as a child. So that could include homelessness, it could include parental divorce, it could include parental incarceration, things like this. And the number of ACEs that adults have increases the risk for negative outcomes, or it's correlated with a higher likelihood of negative outcomes. So what is the role of trauma in executive function? We do know that this is still an emerging field. There's actually only one published study that I know of that directly assessed KID ACEs and KID EF, and it's not a great study, so more of this needs to be done. But we do know that trauma causes changes to brain structure and function, so reduction in volume and blood flow to the brain, this can have differential effects on different brain regions, with prefrontal cortex being most vulnerable to these impairments. And we see these deficits in executive function, in, say, workforce development, issues of people having low executive function, and a high number of ACEs, and including these kinds of symptoms. So this is a highly oversimplified model here about the role of trauma and poverty on executive function development and how it might contribute to a cycle. So with poverty, we do know that stress is strongly related to poverty, so these kinds of stressors here. We also know that stress leads individuals to be more reflexive and less reflective. We see that both in acute stress and also chronic or so-called toxic stress. If kids are in this kind of reflexive, in the moment, relatively chaotic environment that's unpredictable and highly stressful, they're likely to have lower executive function and more behavior problems, say in school, lower school achievement, in turn fewer opportunities, and so forth. So again, poverty and income gaps in the US, it's a so-called wicked problem with a lot of causes. But this is just one way of thinking about how executive function could be impacted. And then, interestingly, though, again, individual differences are there. So in children who are homeless, this is the samples that we studied with Ann Maston. These kids, on average, of course, are, like I said, as much as 2 years behind in terms of age norms on executive function. Nevertheless, there's a subset of them who are performing at age level, despite these adverse circumstances. And when we follow those kids, this is work by Jelena Obradovich and Ann Maston, they found that the kids who had on time development of executive function as preschoolers in the homeless shelter in grade 1 were reported by teachers as, the higher executive function kids were reported by teachers as being what they call resilient, and the kids who had low executive function were reported by teachers to be lower in social emotional skills and school achievement. So in other words, executive function skills can serve as a buffer against low achievement for low-income kids, if for whatever reason and however they achieve that higher level of executive function. So we have considered, what makes for an executive function supportive environment? And we kind of like to think about first things first. So, adequate economic resources, nutrition and early feeding practices, routines for sleep, and reduced stress. And my colleagues and I have done research on each of these bullet points. But recently, my students and I have done a lot of work looking at quality caregiving and its role in executive function development. And there's this aspect of parenting or type of quality parenting called autonomy support. And it means that you're giving the child some guidance on problem solving and encouraging their participation in decisions, offering choices, giving them hints but not doing it for them, not taking over a task, and being controlling, and also not letting them struggle too much on their own, and being what we call laissez-faire. So autonomy support is the idea of helping children just enough so that they're able to use their own skills, build their own agency and sense of autonomy and kind of mastery. And that aids with the internalization of control. So self-control actually develops from the outside in. We really depend upon caregivers to help regulate our behavior at first, and then eventually, and ideally, that gets internalized to have more and more of the control being taken on by the self, for the self, using the sense of agency. And that, my actions matter, and so I better control them. And I can control them myself. So this so-called Goldilocks parenting refers to not giving too much support or control, not too little, but something that's more like just right. And we do see quadratic relations in that regard. So I just want to, if I'm still okay on time, am I okay? I want to show you some examples of what we mean by high autonomy support. So they're doing a tangram task together. And what you'll see here is the dad being very autonomy supportive in terms of giving her choices and letting her manipulate the objects.
So, I think you might be right. It might fit better. So if we switch it with the yellow one we just put on, so we have that green, and there's another piece that goes with the green.
I want these blue ones,
Me
but
too.
it's not the diamond, it's a square thingy.
It is, but it looks like the blue. One side is touching the green side, and it seems to turn it a little bit. What happens if you try that? If you touch one blue side to one green
We
side.
have to have too many of these.
Yeah. Man, too many. How many? Let's see.
Okay, so what happens if you try that? Is that open-ended question, giving her a choice and letting her be an active participant in the task. I just want to contrast that with a low autonomy support example. And I just want to emphasize that this isn't like bad parenting necessarily, to be lower in autonomy support. This isn't a bad parent, but it's a different feel.
Now we need the red ones. The red trapezoids, we need those.
Which way do they go?
Yep, they go this way. See, there's a space between those two, so we need to make sure we get the space in between. So like that, and then this one goes in the front.
They go on the sides.
Yeah. Maybe one more.
Okay, so could you feel the difference there? So she's more directive, controlling of the task. She's right in there with her hands, manipulating it as well. So we've measured and scored this autonomy support in parents, and it does consistently and regularly predict their child's executive function. So I'll just point out here that in this regression model, over and above child age and their letter word identification, this is an achievement, academic achievement test. Over and above that, we see a contribution of parent autonomy support to children's executive function performance. This is a preschool sample of 3-year-olds. And so one thing I want to point out is that being autonomy supportive requires a lot of executive function potentially for the parent. So you have to not take over. If you've ever tried to get a child to daycare on time and they're just learning how to tie their shoes, you're like, yeah, I really want to support this, but we just have to go, and you might be, more likely to rush. And, constantly plan ahead, think about the child's perspective, how the child is thinking, come up with new strategies and so forth. So this is actually quite effortful, conscious and effortful executive function for parents too. And so we because the Minnesota Executive Function Scale is a lifespan measure, we gave the moms the executive function scale, and the dads. We've done this in moms and dads. We gave them the MEFs and their kid the MEFs. And of course, they are correlated significantly with one another. But then we also measured the parents' autonomy support. So the mom's autonomy support and dad's is very strongly related to how autonomy supportive they are with their child. Does that make sense? And then when we look at this, this is a concurrent mediation model using bootstrapping. It's not longitudinal yet. But we see that autonomy support mediates the link between parent EF and child EF, again, and they're now on the same scale with this tool. So I think that's really encouraging because, again, these are skills that can be improved and changed. Maybe they can be improved and changed and coached in moms and dads as well. And because it's coming down to their behavior, not purely active or passive gene expression, gene transmission, there's a role for behavior here. I think it's very encouraging. Okay, and so I'm going to skip through because I just want to show you that interventions do work, but these are early days. There's some promising interventions, including mindfulness and reflection that we focused on. But I just want to bring your attention, given this audience, to something new that we're developing and the role that you could play in this whole endeavor. We have SBIR funding to develop what we're calling the Developmental Cognitive Profiler. And this is the mandate here. It was an RFP for a low-cost, non-invasive, portable, brief tablet digital measure neurocognitive assessment for infants starting at age 12 months that could be used in sub-Saharan Africa and other low-resource countries. That was the call, and we answered it, and they funded us amazingly. And so it's a digital tool that uses eye tracking. So these are nonverbal infants, and it's multi-domain, so it's looking at attention and EF, kind of the early antecedents of executive function, language, spatial cognition, and social cognition. And it's designed for pediatric office as well as field use, like I said, the sub-Saharan Africa. We had to develop with a technology company a portable eye tracker. Eventually, so this is just affixed to the top of the tablet. Eventually, we're going to get the algorithms to a point where we can use the built-in camera of a tablet to get as good of accuracy. That's our hope. But for now, it's a top-mounted camera. This is the setup with the infant looking at the screen, example of that. And then this is, I'm going to show you the attention task. So it's sequence learning. The child's going to watch the screen, and I kind of wish that this mother was less involved in this example, but we'll get that right too. But the child's watching the screen, and you'll see things pop up in different windows here. And we're looking at, using eye tracking, does the child start to anticipate where the next window is going to be open? How quickly does the child learn the sequence? And then we're going to change it. We're going to do a switch, right? So it's kind of like changing from the color game to the animal game. We're going to switch it on them and see how quickly they can adjust and learn the new sequence. So if you watch the child's eyes, you can start to see where the child's looking, kind of. So after several trials of this, we're going to change up that ABC sequence, and it's going to appear over here after some time. So that's the kind of idea. And then the social cognition task. So as I mentioned at the beginning, part of executive function is this cognitive flexibility, being able to appreciate somebody else's perspective. So that's really what's entailed in social cognition and theory of mind, is being able to think about what somebody else is thinking. And we do know that eye gaze is a really important indicator of attention, where somebody else is attending. And that's going to be an early antecedent to figuring out what somebody else is thinking. So first, children key into joint attention, and the idea is that that expands to other mental processes and their ability to consider someone else's mental states. But it starts with something as basic as following someone else's eye gaze. And this is something that would be likely be impaired in children with autism or at risk of autism, like having an older sibling with it.
Hello, my name is Joseph. We're going to have lots of fun today.
So working on getting it a little more natural.
Hello, Joseph. My name is Maria. Are you playing fun games?
Hi, Maria. Yes. Would you like to play a looking game with me?
Yes. Let's play a looking game together.
Okay. Do you see that?
Oh, fun. I see something too.
So they'll do this for a while, and we're watching to see
Wow,
when
look
the
at
infant
that.
starts to anticipate. So that moment between the eye gaze and the appearance of the
Oh,
item,
Look over
are
there.
they able to anticipate it? Okay, and then I'm going to end with an example of translational research here, where Mount Sinai is actually kind of doing something at the intersection of this developmental science on executive function and preventive medicine in collaboration with the Bezos Family Foundation. So they're training pediatricians in child development and or residents, medical residents. This is the pediatrician pipeline that you guys are probably well aware of. So there are 200 residency programs nationwide, over almost 3,000 new residents annually, who are seeing 1,500 patients on average per pediatrician, with potentially then millions of children being reached in terms of this access, right? So pediatric residents are considered to be really important players in prevention of difficulties with neurocognitive processes, including executive function, if they know more about it. So that's just one example locally here, and many of you probably already are aware of it and know more about it than I do, but I thought it was a nice example. So this is the end of the talk at last, and I have too many takeaway messages, I know, for you today, but we did cover a lot. And so I'll just leave those up here, and I'll be happy to take questions. Thank you.
Thank you so much, Stephanie, for such a great talk. And I have a question, but I think first we'll go to the audience. If anyone has one already prepared, their executive functioning was working, fantastic. Please take yep, go ahead.
Hi, thank you for that talk. It was fabulous. Invoking a little bit of evolutionary psychology, I'm just wondering, since we're looking at EF sort of in isolation, for those that are experiencing adversity earlier on, is it actually adaptive to not sort of develop that EF? And so are there outcome measures in which those kids actually do better than perhaps those kids who are facing adversity who do have robust EF? Just because I can imagine that sort of scanning the environment and not sort of anticipating because there's no benefit to pattern recognition because there is no pattern because life is chaotic.
Right.
Are there other ways in which they actually do better or fare better? Maybe not the outcomes that you presented today, but others.
Yeah, this is a really interesting question, and I presume everyone heard it because we've got a mic, which is great. So that is a topic of interest. I'm actually on a dissertation committee for somebody at University of Minnesota who's studying just that. So two things, we don't know yet, really, but preliminary evidence so far. One is that on the delay of gratification task, the marshmallow test, we do see that Walter Michel had actually shown this back in the 1950s, which is unbelievable, that if the examiner is shown to be untrustworthy, that kids don't wait. So I think that's an interesting model for what might be going on in high chaos, high adversity, high poverty situations where it's really not a very good bet to delay for a larger reward later. Then this other work that's been happening at, I'm most familiar with the work happening at University of Minnesota, is with adults who had experienced adversity as children, using some neurocognitive measures with them, and showing that if you remind them of their childhood adversity, like if you have them read a passage that reminds them of financial insecurity, they will temporarily do more poorly on the neurocognitive assessment. But to date, there's not strong evidence of advantages, at least not on any of these cool executive function measures that I tend to focus on, for this being a sign of adaptation. Yeah.
Deborah. Yeah.
Okay.
It's so interesting. Thank you so much. I was surprised to see that you said that all executive function was conscious, because certainly we do many things, such as affect regulation and attending to things, without there being conscious.
Right. So they started out as more conscious. And so when it's executive function when and only when it's still effortful. That's when we see stronger activation of PFC, and when we see errors, and error monitoring is when you catch yourself that, oh, I went on autopilot, and then I sort of caught myself that I had lost track of my goal, or I became emotionally dysregulated and angry and did something impulsive. So we tend to go on autopilot, and then the goal can come back into focus, and that's kind of when you're kicking those processes into gear.
What do you call those functions when they're not conscious? Want to repeat that?
What do I call those functions when they're not conscious? So, I mean, I get what you're saying, that obviously you're still using your working memory, and you're still using some inhibition and flexibility, but you're using them in an overlearned way that's no longer effortful or as effortful. So, I mean, I'm happy to accept that you're still using your executive function skills, but we focus on when those things are not working well, in order to study its development.
Great. Yeah, they're in the back. Yeah.
Thank you so much. How do you foresee these measures that you're developing in a research setting being translated into the way that we do neuropsychological assessments now, with regard to increasing our ecological validity, knowing that our tests aren't so great, the ones that we use? What's that timeline even look like, and is it going to be integrated into like maybe a current battery, or how do you think it'll change neuropsych assessment?
Yeah, I think that's evolving. So we have a free trial on a large scale happening at Cincinnati Children's Hospital, using the MEFs alongside their other assessments. And then, of course, they have the diagnostic information to go along with it. So that's going to be a validation study that they put out, I hope. And then nationwide, Seattle Children's, there are a number of clinics that are now using the tool. It's most widely used by educators and nonprofits that want to evaluate their programs and measure them for their stakeholders. But a minority of users are clinicians, and I hope that increases so that we can answer your question more fully.
Other questions, or should I jump in for? Okay, not yet. I was curious about, given the focus on parents' EF and how strongly it relates to the child, that just seemed like such an important link to make. And how do you then think about interventions? Are there going to be some families where it's enough to go for the child and do a little bit of scaffolding that's not happening at home, or some families where all that work is going to be undermined if they go home and the EF, because of the parents' problems with EF, can't be supported? So where do you, are there two different kinds of interventions for different families, and you triage it?
In the past, they were two different kinds of interventions. There were child-focused curricula and one-on-one training, and then or there were parent and caregiver-focused interventions. But now, increasingly, people are seeing the merits of doing a two-generation approach, I think this evidence speaks to the need for that. Because just as you said, you can do everything you want that's great for 6 hours a day at school, and then have them go home, and it's all undone.
So how with the adults do you, what are the tools or the approach?
So there are parent education programs like Mind in the Making by Ellen Galinsky locally, and a lot of the work out of Frontiers of Innovation at the Harvard Center on the Developing Child. It's almost a requirement now, I think, that those be two-generation approaches. So there is parent video feedback, so videotaped interaction with your child. It's called the FIND intervention out of Phil Fisher's lab at University of Oregon. So that's giving parents gentle, constructive feedback on how they interact with their baby or child, serve and return, tuning into the child's attention, promoting the child's autonomy. And then we have started to, given our findings on autonomy support, we have dabbled in coaching moms and dads how to be more autonomy supportive. And we've done this only in the laboratory so far, and what we found is that for parents who were not already at the top of the scale in autonomy support, we were able to move the dial in a brief one-session training program showing them that model of Ross being a really excellent autonomy supportive dad. But that needs to be replicated in a more diverse sample and so forth.
Yes, Kim.
Thanks, Stephanie, for that wonderful talk. There was so much that was fascinating. One point that I thought was particularly tantalizing was this idea of, so you've linked baseline EEG power with EF, and you talked about, could EF change brain function, which sort of makes intuitive sense, but then you dangled this notion of, could we change brain function via neurofeedback to affect EF? I wonder if you could just talk for a brief moment about what that might look like.
Yeah, so we are narrowing in on a signature for in terms of EEG power for higher executive function in terms of this theta beta ratio. And so what if we have kids perform an attention task and they're getting feedback about their theta beta ratio, and the task is visual on a screen. In order to do the task, they need to be able to see the stimuli, but if they're in that zone, the stimuli clarify and they can perform the task. But if they start to slip out of that zone in terms of EEG power, the stimulus array starts to become opaque. And so you can train the brain over time to keep the stimuli clarified so that you can perform the task. That's one example of how we might do that.
Super cool.
Yeah, thanks.
Really terrific. One more quickie, and then we have to go to lunch, please.
So just to throw this out, I've heard that CEOs, especially male CEOs, if they're very athletic, often tend to have a poor attention span, or at least that they have a greatly shifting Stroop-like ability to move from one thing to another thing. In other words, they don't get hung up on details, and that can be a leadership factor. So is it possible that there's some tail of this where the opposite of everything you say is true?
Definitely get headlines if I could. I've heard that theory, and as a CEO and interacting in the more business world, the last couple of years, when I was doing that, I'm now chief science officer and kind of back in my lab home. But I certainly saw that, a lot of that. And it can be a leadership skill. I mean, I think could be one example of, very high shifting ability. And, in a way, it is demonstrating a lack of perseveration, lack of rumination, perseveration on details that can kind of interfere with the longer term goal. I think it's consistent actually in a number of ways with good executive function.
Great. So we want to thank you again for a wonderful talk.
Thank you.
And everyone, as usual, is welcome to join the residents up on the 6th floor for lunch with Dr. Carlson.